Hi, everybody. It's Kevin and Kristin from RPH Ally and the Lab Services and Point of Care Testing Show. It feels like it's been way too long since I've seen Kristin. I have missed her. And I know you guys have missed her too. You're going to see a utilizing a diabetes prevention program to test title up there. It's exactly what it is. We know that we have to utilize already existing things to make our jobs easier. And Kristin's going to show us how to do it, how to optimize it, and how to increase in profit. To be able to connect with us, make sure you're going over to rphally.com and then joining Kristin's channel at Lab Service and Point of Care Testing to get even more insights after the show. We'll talk to you soon. All right, Kristin. So I got back from a whirlwind of conferences and vacations and babies being born and all that good stuff for my family. And I'm excited about this one because it's kind of a combination of all three when we're utilizing a diabetes prevention program to leverage testing. So taking stuff that's familiar, something that is exciting and something that is new and plugging those all together in one space. I'm actually proud of myself that I looped those things all together like that, Kristin. So I'm going to pat myself on the back. How are you? How have you been? And let's hear more about this really exciting topic.
Oh, fantastic. Thank you so much, Kevin. And I wanted to talk about this because I'm actually in session 7 or 8 with my own diabetes prevention program group. And I thought to myself, other pharmacists need to hear about this because it's an untapped resource. Specifically, DPP as a diabetes prevention program is an untapped resource. And we're not going to get into the nitty gritty of that specifically today. But if you're not familiar with the DPP program, it is different than DSMES. You don't have to go through the rigorous credentialing and all of that stuff. It is literally accessible. The curriculum is already made and approved by the CDC, and you have access to it. The public really has access to it. There are CE programs specific for pharmacists in different areas, training for you to be a trainer for the DPP programs. And so if you want any more information on that, let me know. But what I'm saying is that it's already created for you. The program is already created for you. And the idea is that you can, yes, bill medical insurance once you've gotten your certification, and there's all these things. But you can charge cash for this program is what I'm getting at. Or you can use grants in order to provide this program to your customers for free. And it's a really great program to help with weight loss and increasing activity, which clearly reduces the risk of diabetes. I'm actively going through it. The participants are loving the program. And we actually did an A1C at the very beginning, but you could also do a lipid panel at the very beginning to get a nice baseline range, right? So you're going to be, a DPP program is traditionally done over the course of 12 to potentially 24 months. So just imagine how much of an impact you can have. It ends up being 22 plus sessions with these people. And so imagine the impact you can have on someone's A1C or lipid panel from, during that time period, and getting that at baseline is essential to actually showing the changes that you're making.
Yeah, I just pulled it up, Kristin. I had not personally heard of this before.
Is
it? Yeah. And so I just saw that there was an infographic kind of connected to it. So can you walk us through like what this 12-week to 24-week, 12-month, right, to 24-month period of time, 1 to 2 years of connecting people and dots, going through this like kind of infographic? What are the pillars and elements to understand for the pharmacists out there that are listening, or pharmacy technicians?
Yeah, so this is different. So pillar number 1 is that this is different than DSMES. Also, too, the National Diabetes Prevention Program is slightly different than other diabetes prevention programs because there have been spinoffs of the National Diabetes Prevention Program. And so that's not necessarily a bad thing because there are curriculum that have been approved by the CDC. So even all of these various spinoffs that have been created, they're usually created by universities. And they are also approved by CDC. So it's very similar to the National Diabetes Prevention Program. But the goal of these programs in general is to help educate people on nutrition. And the focus is on calories and actually also your daily fat consumption, and then also increasing activity. And what I love about it is that it does this in a very slow, stepwise fashion so that it is very user-friendly when it comes to actually creating habit change.
Wow. No, it's great that they make it so highly consumable for you. You want to be able to recognize like all the elements necessary and then try to broaden that like kind of breadth of time. When I was a
Yeah.
pharmacy director, I remember Stanford coming and talking to me about implementing this at the hospital. And throughout kind of the programmatic setting, something similar to this. I'm glad that you said that it could be coming from a university. When it comes to the grant-based funding, Kristin, anything you wanted to touch on there before we move to the cash models and how to connect that to point of care testing?
So one of the things that I have noticed is that a lot of mine anyway, my local health departments already have programs that are pushing this DPP program out to the public. So if they're consuming those funds already, I think they might be a little bit less reluctant to then pass on funds for somebody else to do the same program. So that is something to kind of be aware of. That would be another thing that I would check into if you're interested in doing that. Just see if your local health department is already kind of doing stuff with DPP. If not, you have a huge area of opportunity, like enormous, hundreds of thousands of dollars of opportunity to roll out a DPP program because it's just scientifically proven to actually work. And I will tell you, I mean, I'm seeing the same thing just in 7 sessions, which has been 7 weeks. I have one patient that's lost 15 pounds, maybe 17 pounds. Others are just kind of like trickling, but it really is very impactful.
Wow. Super exciting and glad to hear that some of that funding and things are available for it. Not billable necessarily without the certification, as you mentioned, but there's grant funding and now there's cash offerings that we can obviously do as well for it. So how does that work? How do we integrate it with testing, Kristin?
Yeah, I mean, I love my cash programs, and you can eventually bill insurance. I just want to let people know that might be watching this show that you can bill, but there's a CDC approval process that kind of has to happen, and it actually takes over 12 months for you to be doing the program in order to meet those qualifications and then start to bill. So there's a little bit of a waiting period.
Okay.
And different work that you need to do in order to meet that criteria. So cash is easy, right? Cash is, you can just kind of do your thing and not worry about having to necessarily meet that criteria. But how to integrate it with testing, like I said, I think getting values at baseline that are in line with what it is that we're doing, right? So we're helping people lose weight. We're helping them eat better. We're helping them increase activity. So what kind of things do I want? I want an A1C. Obviously, it's a diabetes prevention program. But then I would also want a lipid panel. And I didn't do that this time, but I would definitely use that as an opportunity if you're doing testing to do all the testing at the very beginning, as much testing as that person is willing to kind of pay for, I guess, or just include it in the price that you're charging the patient so that they're getting the testing as part of the overall package for the monthly membership fee that they might be paying.
Makes sense.
That's how I would do it. I would do it as a monthly membership fee and just include XYZ in your kind of like your deliverables or value-based items. And so anyway, we could do finger pricks for A1C right with the patient right in front of us. We can do finger pricks for lipid panels through our CLIA waived labs. We can then also order labs, an actual blood draw that you can send your patient to your local lab core in order to get done and get more comprehensive labs done. Maybe you want a full iron panel. Maybe you want a full thyroid panel, CBCs, CMPs, like all kinds of stuff. And, if you want to know how to do that, what to order, all of that, then, I can help you with one-on-one coaching or something along those lines. But you can do it. In the majority of the states, you can order blood labs as a pharmacist. Now they are there is an out-of-pocket cost to the patient in order to do that. You can't bill insurance for it. But imagine having all of that data at the very beginning of this program and then doing that again, maybe in 3 to 6 months, if you're doing the full year, and seeing the huge impact that you're making on these patients' blood work. Like that is data that other practitioners want to see, and the value add that we need to be showing as pharmacists.
Tell me this, Kristin, we mentioned a few terms in like terms of testing and send out testing and going through different programs. Is there any incident to or collaborative practice necessities for this program to work and for you as a pharmacist?
No, not at all. I mean, unless you wanted to start messing around with people's medication lists and doses and things like that. But no, I haven't run into any reason as to why you would need that. Not to mention this also, and this isn't really the point of this talk, but this also opens up a huge opportunity to talk to these customers about, supplements that might also be able to help them metabolically.
Mm-hmm. I mean, it makes sense. I mean, if you're going to do one thing, I think that everything starts getting compiled all together with saying if you're going to do the program needs testing for it to show results and for them to feel like they're making progress and to see where the baseline is. And then for them to make better progress, lifestyle changes, modifications, exercise and diet is connected to some of the supplement utilization for lab correction, et cetera. I think those all tie in well. How do you take it, Kristin, from just it's everywhere. Like you got all these opportunities to do and really streamline that. I mean, I know that in your programs that you have kind of rocking and rolling, you teach people step by step how to do it. But what's a good starter point to say, hey, here's how you take all of these things you could consider doing under the DPP program. Or I guess it is diabetes prevention program. So I don't need to add an extra program. DPP. How do you then start folding everything in and what makes the most sense with the way they lay the program out so it can kind of fit and feel streamlined for those individuals? Are you scheduling things like on a calendar kind of basis? Like here's what we're going to do it this month. Here's what we're going to do this month. Or is it something that you've really individualized, like algorithmically? If the patient has these issues, we do this. If the patient has this setup, we do this.
So I think it's great to kind of give to create a membership, and there's certain things that are included in this membership. Remember these sessions that you're having as a DPP provider are group sessions. Also, I would highly recommend that you do them in person because people then create that sense of community. We've really lost that over the last several years, and people are really kind of yearning for it. Not to mention the action that people take when they have to show up somewhere is a lot bigger than if it's just another virtual offering. So you have this membership, you have these people coming to your sessions as a group. So you're not meeting with each person individually, but if these people are part of your membership, maybe you could create this like upsell for people who do want to meet with you one-on-one, and maybe they get a slight discount or something, whatever that next offering is. But you're right. There's so many different things that we can be doing as pharmacists. It's like, how do we decide what to even go after? And I think it's important to think about what it is that you enjoy talking about. What do you find yourself reading about online? What do you find yourself searching for randomly? What do people ask you about? Those are kind of good ways to hint at what you're interested in the pharmacy or health and wellness landscape. And then, also your community. What is your community kind of lacking? What's already existing? You might have an idea, but like I said, you might want to do this DPP program, but there might be 15 other ones, within a mile radius. So, the need in your community, I think, is huge. And then also the ROI. I mean, that's clearly important. So how can we roll this out and make it actually something that can be done on a regular basis that's not consuming like all of your time? And you can really, if you have a pharmacy, you have an untapped market of patients that are constantly coming into you to pick up prescriptions. You literally could print out a list of patients who have diabetes, and then utilize your staff to do a lot of this work, really.
It makes so much sense, Kristin. And I'm just looking and seeing that there's, some people's insurance is offering similar programs. Some people's employers, probably a wellness plan, is offering some similar types of programs. But when we're looking to enroll individuals, and you're talking about the ROI to look at like which of my patients that I currently serve, or the ones that I would be targeting, or the folks that I'm connected to, like here's the demographics they sit in. Mm-hmm. Can you walk us through just this last piece so people know, like, here's how broad DPP actually is and who we're taking care of?
Yeah, and I also, before I even start looking at or talking about this, because people can kind of see what these bullet points are, is
Yeah.
this is another reason why I like to do cash. I like because then you don't necessarily have to follow these rules so specifically.
Oh,
Um,
got it.
like so can you scroll back up for me?
Yes, of course.
I'm sorry. So I mean, I probably just my personal preference. You could do whatever age you want, but I've still made it over 18 years or older.
Hmm.
So this is all, so you can see on the left-hand side, it says all participants must. So this is in order for you to get reimbursed by insurance, the enrollees of your DPP program have to meet these criteria. So the second thing is not be pregnant at the time of enrollment. The third thing is they have to have they have to be at least overweight per the BMI scale, and not have a previous diagnosis of type 1 and type 2 diabetes before enrollment. So truly you are trying to capitalize. The point of the DPP program is to get the patients who are on the track to diabetes. We want to prevent it, okay? And so this program's been shown to do that. But in my humble opinion, type 2 diabetics can hugely be helped and positively impacted by using this exact program, because they don't know what their sugar levels for what should be most of the time. Most of the time, they're not even testing, or some doctor, not to speak poorly, but some doctor told them to only test twice a week. Or do you know what I'm saying? Like, there's all kinds of bad information floating around. And if you don't bill, then you can accept some more people into your program that might really benefit from it.
Wow. Okay. So to bill, to qualify, like these are the requirements that are necessary as per the DPP, setup. But
Yes.
if you go cash based, then you can vary these however you would want to, that you could take care of like, for example, if you have a mom that has gestational diabetes, or if you've got a type 1 or type 2 recently diagnosed individual, maybe especially type 2 recently diagnosed individual, to be able to move forward with that and help with A1Cs. But it does even highlight the participants kind of qualifications of where their A1Cs would sit, if they're pre-diabetic, et cetera. And it does, I'm glad you highlighted that, Kristin, that it is somewhat limiting, on the overall scope, as opposed to you being able to offer it directly to your community, take anybody that you want to be able to connect the dots here. Because honestly, even the scrolling back up real quick, even the overweight like kind of piece, depending on, your feelings on the body mass index, you could have individuals that have, fat percentages that are higher, or folks that just want to stay in good shape or healthy, or they're feeling terrible. And you can see there being some kind of glucose levels that they could just be interested in going, I just want glucose monitoring, for me to be able to help me out with kind of this overall progression. And guess what? We can do so. And I think with Kristin's expertise and background for fighting and advocating for patients, we need to do that with glucose monitoring more often. But any other parting words, Kristin, for the audience on how they can leverage this other than just the, do it, make it cash, add testing, add the other services on top?
What was your question? Sorry.
What kind of parting words did you? I'm sitting in my
I was
house.
thinking about something else.
I think I'm on Pacific time. So with that, like kind of closing thoughts, what other things do you want people to think about when they think about DPP and tying that with lab services and point of care testing?
I don't know if I can. I mean, I love that at the very end you mentioned continuous glucose monitoring, because that's another thing that could be spinned into it. I think that they could be taken in so many different directions, and each individual person, business owner, needs to decide where they want to go with it. But it's a huge untapped market with, I think, a ton of opportunity.
I love that they've established a canvas and kind of the size of the canvas. Then you get to be your own painter, depending on what you care about, what you're motivated by, as you talked about before, and get started with it. So,
and I'm sorry, not to cut you off. I do have to say that if you are using the curriculum, you do have to give credit to the curriculum. So if you're using a DPP program, whatever it's called, you do have to say that that's what it is that you're using. You can't just take the material and then, I don't know,
and run with it. Got it. Hashtag DPP.
Yeah, exactly.
Okay, perfect. Well, thank you so much, Kristin, for those insights. It's so good to see you. And I'm really excited about how this can help and impact communities. And I didn't realize it was actually available. So I'll peek at more of it, and then we'll tie it into the show notes so folks can see it. If you want to see even more, get more details on programs like this, go ahead and head over to rphally.com. Have all your registration information ready, which is your license information, email, name. Jump on in there, join Kristin's channel on lab services and point of care testing, and start blasting her with questions. I know I'm going to start hitting her up on her channel here really soon about this DPP program, and we'll see you guys in there. Have a good rest of the day.
Bye, guys.